What is telogen phase hair loss during reproductive cancer treatment? Have you ever wondered why some people experience hair loss during cancer treatment? One common reason is telogen phase hair loss, also known as telogen effluvium. This type of hair loss happens when a large number of hair follicles suddenly enter the telogen phase, which is the resting phase of the hair growth cycle. Normally, hair grows in cycles that include the anagen phase, where hair grows, the catagen phase, which is a transition phase, and the telogen phase, where hair rests. When someone undergoes treatment for reproductive cancers, such as testicular cancer or cervical cancer, the stress of the treatment can disrupt this cycle. Treatments like chemotherapy, hormone therapy, targeted therapy, and radiotherapy can cause hair follicles to shift prematurely into the telogen phase. This results in increased hair shedding, typically starting about 1 to 3 months after the treatment begins. Chemotherapy is often the main culprit behind telogen effluvium in cancer patients. However, hormone therapies, which are frequently used in reproductive cancers, as well as targeted therapies and radiotherapy, can also lead to hair thinning or loss. The specific drugs used and the areas treated with radiation can influence how much hair is lost and the pattern of that loss. The hair loss associated with telogen effluvium is usually diffuse, meaning it spreads evenly across the scalp rather than occurring in patches. It can also affect other areas, such as eyebrows and eyelashes, depending on the treatment. In cases where radiotherapy is involved, hair loss tends to be localized to the area that received treatment. The good news is that hair typically regrows after treatment ends, although the timing can vary from person to person. Some individuals may notice persistent thinning if their treatments are prolonged or combined. For those looking for ways to manage hair loss during treatment, some strategies may help. Scalp cooling methods can protect hair follicles during chemotherapy, and topical agents like minoxidil may promote hair regrowth after treatment. However, the effectiveness of these interventions can differ, so it's essential to discuss options with healthcare providers. It's also important to acknowledge the emotional impact of hair loss. For many patients, losing hair can significantly affect self-image and quality of life during treatment. Supportive care and counseling can play a crucial role in helping individuals cope with these changes. In summary, telogen phase hair loss during reproductive cancer treatment is a common side effect caused by disruptions in the hair growth cycle due to cancer therapies. While it can be distressing, this type of hair loss is usually temporary and resolves after treatment. Patients are encouraged to consult their healthcare teams for personalized advice and support options.